Good afternoon, everyone. I'm pleased to welcome you all to this edition of the Johnson & Johnson Allergy Webinars brought to you by Zyrtec. We are very happy that you are joining our virtual audience to engage in discussions around delivering optimal care and improving the lives of patients with allergies. My name is Kirsten Wagner. I'm part of the Medical, Clinical, and Applied Science team here at Johnson & Johnson Consumer Health, and I have the pleasure to moderate this session. And I also want to welcome our special guest speaker, Dr. Howard Drews. Howard, welcome. We're so glad to have you join our discussion today. And honestly, we can't wait to hear your insights.
Thank you, Kirsten. I'm thrilled to be here.
Wonderful. Great to have you with us. Before we dive in, I would just like to introduce you to our presenters today, Dr. Drews and also Dr. Nehali Shah. So Howard Drews is an experienced allergist who has extensive experience in both patient care and developing new medications for asthma, allergy, and immunology. He's a practicing allergist at Ear, Nose, and Throat Care PC in Somerville, New Jersey, and he is currently a clinical professor of medicine at Rutgers, New Jersey Medical School in Newark. In addition, Dr. Drews is a diplomate of the American Board of Internal Medicine and the American Board of Allergy and Immunology. He's a fellow of both the American Academy and College of Allergy, Asthma, and Immunology, as well as the American College of Physicians. We also have Dr. Nehali Shah, who is part of our medical affairs team at Johnson & Johnson. She completed her doctorate of pharmacy from University of New England in Portland, Maine, and is currently leading our allergy and cough cold medical team with her medical and pharmaceutical expertise. So welcome, Dr. Drews and Dr. Shah. We're grateful for sharing your expertise with us today. Before we now start the webinar, we have a few legal disclaimers that I will need to point out that you can see on the next slide. So as you know, all information that is provided during this program is consistent with approved product labeling of the Johnson & Johnson products. Questions that we might be unable to answer during this presentation can be submitted to our medical information department for follow-up. You see the number here on the slide, and our colleagues will respond to you accordingly. Next slide, please. You also know this webinar is brought to you by Johnson & Johnson Consumer Healthcare. We're the manufacturers of Zyrtec. The content of this presentation was developed by the presenter in conjunction with Johnson & Johnson. However, the views, the opinions, and the comments of the presenter, of course, are solely his own. The presenter has been compensated for this presentation. And if you ask yourself, what are these wonderful images that we have in the presentation? They are rights under the rights of Johnson & Johnson or stock photos. Next slide, please. Then I also want to let the viewing audience know that this is your opportunity to ask questions. Dr. Drews will be here throughout the conversation, of course, so please take advantage of our Poll Everywhere page that you can see here. The link is here on that slide. If you have a smartphone, you can also just scan the QR code and you will have our site where you can put in a question. We will keep a running list of your questions and then we'll address the topics that will bubble up at the end of our conversation. All right, we have an exciting program today. So let's take a quick look at the agenda that we have lined up. We will start with Dr. Drews talking about the importance of measuring quality of life. We will then have Dr. Shah to present Zyrtec clinical data, also about quality of life, and then have a conversation about experiences from the allergist's office, where Dr. Drews will then be able to give us some tips and tricks. And in the end, we're going to answer a couple questions. All right, so let's begin by grounding everyone on quality of life. Dr. Drews, over to you, please.
Thank you, Kirsten. I'm really delighted that Johnson & Johnson have selected quality of life as the first of these webinars, because what's more important to people who suffer from chronic conditions? You know, allergies are illnesses, conditions, diseases, if you will, which there's no cure. Patients who come into the office are really often looking for a cure, and we can't promise a cure for this any more than we can cure hypertension, arthritis, etc. So to help patients who have allergic conditions, or those who don't become our patients, and we'll talk about this a little later, patients who suffer, people who suffer from allergies, we need to try and assess really what is happening to them, how the allergy impacts their life in a real way, and how we can help them. So we need to separate the effects of the allergic disease, and we'll be talking a lot more about rhinitis, allergic rhinitis, from specific symptoms like nasal congestion, drippy nose, postnasal drip, and cough. It's important because many patients have one or the other or many of these symptoms, and the particular symptom may not bother them. However, if they are not able to do the things they want to do, to enjoy life in the way they want to enjoy life, then we are really in a position where we can help them with medications such as Zyrtec and other medications for allergies. So what we're going to do in the first part of this presentation is define quality of life, not just as a general expression, but as a quantitative and measurable number that really has some significant meaning. Now, you know that patients who say, I have allergies, often use that term loosely. People say, I'm allergic to Monday morning. I'm allergic to work. Well, they mean they don't like it. It's something that upsets them. But we understand allergy to mean a disease that's mediated by immunoglobulin E and mast cells and histamine and chemical mediators. And so as we define quality of life, you'll see it has a significant value and something that we can actually measure in a controlled way. So although the individual parts of quality of life, the individual components which relate to human experience are very, very subjective, we can put these down and we can catalog them in what we call an instrument so that we can measure them, compare them, and we can assess response to treatment, know that our treatment is working not just on drippy noses or stuffy noses, but on the sort of things that really impact people who suffer from allergies. Let's go to the next slide. So as I just mentioned, quality of life is measured by an instrument. So what is a quality of life instrument? Essentially, it's a questionnaire that's constructed with questions in different categories, which are called domains. And these domains relate to different parts of functioning. For example, there will be questions about the daily activities of life. When you get up in the morning, does it affect you going to work, getting dressed, moving around? There are questionnaires that are general, and there are ones that are disease specific. So the most commonly used questionnaire is a very short questionnaire, which is called SF36, the short form 36 questions. It's a short form, and it's useful for people with many, many different types of chronic condition. So if you wanted to compare the effect of quality of life in somebody who has chronic arthritis versus somebody that has chronic rhinitis, you can use a general instrument. And by the use of general instruments, we have learned that the impact of the quality of life in rhinitis is just as significant as people who have heart disease or who have chronic arthritis. So it's really very important to measure this and evaluate it. Now, there are specific ones, which we'll talk about in a little bit more detail, are specifically for respiratory diseases. There's not a situation where one is necessarily better than another. You have to know why you're asking the question. If we want to take a group of people with allergies, with symptoms of the nose and the eyes and cough, fatigue, we will select a specific disease-related instrument. If we want to take a very large population of people with multiple different conditions, arthritis, high blood pressure, and allergies as good examples, then we might want to take a general instrument. In fact, we can take multiple instruments. We can take specific and general, or two specific ones. These questionnaires can be adapted for adults, for children, for different cultures, where people do not have language skills. They can be constructed with pictograms, with pictures, and in languages that are appropriate for the population that's being measured. For people with low health literacy, who don't understand a lot of the jargon that we use, there are specific questionnaires that relate to them and make it important that we take note of what they are suffering from. Let's go to the next slide. So this is one example of a very well recognized questionnaire. It's called the Rhino-Conjunctivitis Quality of Life Questionnaire. It has 28 questions and it has 7 separate domains. Each set of questions has a score, and also these questions are what we call validated. And we're going to talk a little bit more about validation, because when you devise a questionnaire, you want to anchor it or relate it to some other measurement that has been measured before, so that we know that it has relevance and significance compared to something that we know about, such as patient symptoms. So, for example, when we're doing a clinical trial of a rhinitis drug, as Nahali will show you a little later, the questionnaires such as this are validated against symptom scores so that they can be measured at repeated intervals, and knowing that we're actually measuring something of significance. Let's go to the next slide. So, why is validation important? The term validation is something you'll see in a lot of scientific papers, and you'll hear people talking about it a lot. There are formal definitions of validation. Ultimately, it becomes down to a mathematical process, but in the ideal situation, you would take a questionnaire, you would compare it to a gold standard, perhaps something objective, an objective measurement, if that's available, or a symptom score that has been used for many years, and you would compare this particular questionnaire done repeatedly on different people and on the same person to see the variability between people and the variability within the individual, and so that you end up with something that's reliable and reproducible. Next slide. One of the most surprising observations came out fairly late in the story of measuring quality of life. And in the days when the most commonly used medications for allergies were the sedating or first-generation antihistamines, there were measurements of quality of life done in people who were treated and who were not treated, and the difference was measured, and there was a significant impact in quality of life on those patients who were given medication for their allergies. What was not realized, because it wasn't measured, that the allergies themselves had a very significant impact on quality of life. And so we realize now it's not just medications that make people sedated or not able to concentrate or to perform well at school, but it's the allergies themselves that can do that. Now, clearly, on a day when the pollen is out and you spend time outdoors and you can see the pollen on the sidewalk or you can see it on your car, and you know that the air is full of pollen, then it's quite obvious that that can irritate you and cause allergic symptoms as well. But indoors and at other times, it is more subtle. And so we realize that the impact of allergy on quality of life may not always be visible. It can be physical, it can be psychological, and it can be social. We don't want to do things when we feel miserable. We don't want to go out and meet friends. We don't want to go out and watch the kids play soccer. We don't want to go on picnics. And so these are all things that we can capture in a quality of life questionnaire and instrument. So whether it's a sleep disturbance, work performance, we can measure the effect of allergy, we can measure the effect of medication, we can separate these two. And though that by doing this, we can provide the best treatment for each person who has allergic problems, whether it's chronic or it's acute, or whether it's indoors or outdoors. And we can tailor, as you will see a little later on, our therapy based on not only what we know about symptom relief, but also the most important effect on quality of life. Okay, let's proceed. And now we're going to move on to Nahali.
Great, thank you, Dr. Druce. So hi everyone, it's really great to be with you guys. As Dr. Druce said, my name is Nahali, and I'll be going over the quality of life data we have for Zyrtec. So as Dr. Druce has been discussing, quality of life takes into consideration issues that are beyond just nasal discomfort. Allergies can play a major impact in the lives of your patients and simply make it challenging for them to do their everyday activities. And that's why one of the goals is to provide therapy options that can reduce these daily impairments so that we can have patients getting on their day without having to worry about allergy symptoms. Next slide, please. So with Zyrtec, or cetirizine, a second-generation H1 receptor antagonist, it was found in 2 studies to induce significant improvement in quality of life of patients with seasonal allergic rhinitis, as measured by the RQLQ, which, as Dr. Druce mentioned, is a disease-specific validated measurement of quality of life. And these studies used the 28-item RQLQ, which measured 7 domains. And those include activity limitation, sleep problems, nose symptoms, eye symptoms, non-hay fever symptoms, practical problems, and emotional function. And in these 2 multi-center randomized double-blind placebo-controlled clinical studies of more than 1,000 adults with seasonal allergic rhinitis, patients receiving Zyrtec reported 56% to 63% greater improvements in overall RQLQ scores compared with placebo. Next slide, please. In another large multi-center randomized double-blind placebo-controlled study, which included 316 adults with perennial allergic rhinitis, we can also see improvement, an 80% greater improvement in quality of life with Zyrtec compared with placebo. And just like the other two studies from the previous slide, the primary endpoint here measured changes in overall RQLQ score from baseline, except this was a 24-item RQLQ, which measured 6 domains. So every domain that I had mentioned prior, except for eye symptoms. Next slide, please. Like the other studies mentioned, this study looked not only at RQLQ, but it also looked at the allergy-specific work productivity and activity impairment questionnaire, which is used to evaluate an individual's perception of the impact of their allergic rhinitis on work. So scores were reported as 0% to 100% impairment due to allergy symptoms. And the results were reported as percentage change in scores for 7 individual domains. And one of those domains included impairment at work. And as we can see here, Zyrtec was associated with significant reduction from baseline at week 2 in the domain of work impairment versus placebo. And now I'll hand it back over to Dr. Druce, who will finish up our allergy discussion on powerful ways HCPs can learn more about their patient's condition and ultimately improve their treatment journey. So back to you, Dr. Druce.
Holly, thank you. So we have the next slide, please. When someone comes to a doctor's office, we call them a patient. When somebody goes to a drugstore and buys a product, they're not a patient, they're nobody's patient. So we often call them a sufferer. So what's the difference really between allergy sufferers and allergy patients? Because after all, many medications which were prescription and which were obtained from healthcare providers are now available over the counter. And so many patients remain sufferers but never become patients. So where does the borderline come in? So epidemiologic studies have shown that approximately 80% of patients who have allergies, they never seek medical help. They diagnose themselves and they treat the condition themselves. So for the most part, this is just fine. They do very well, they're happy, and they don't necessarily need to see a healthcare provider. This is, I think, fine, provided these sufferers read the instructions on the medications that they get. And I think it's fine if they use the medications for the indications that are on the product. Clearly, if you have a product that says do not use for more than 3 days, and you decide to use this for a constant period for weeks, months, and years, then the consequences of that might not be what you desire. If you get a product over the counter and it doesn't satisfy your needs, or your symptoms are not quite what it says on the bottle or the box, then I think it's really important to see a healthcare provider. Now, when somebody comes to see a healthcare provider, I think that it's important that we don't accept the patient's diagnosis of allergy as being necessarily definitive. As I mentioned right at the beginning, allergy has a popular definition as well as a scientific definition. And so I think it's really critical to ask certain questions. And these questions really, I think, should be, as far as possible, as open-ended as possible. So you can start off by saying, why are you here? What's bothering you? Leave this to be very, very open-ended. And then if the patient says, well, doctor, it's my allergies, I think you would want to say, what do you mean by allergies? You might be surprised. Some people will say, it's the itching in my ears, or the itching in my throat, or my eyes bother me, or I'm so tired in the spring or the fall. You might be very surprised at how an allergy sufferer, when they become an allergy patient, decides to define what's bothering. And then you want to ask them what they have tried before. Have they tried a particular medication? And if so, for how long did they try it? If somebody said, well, I took one pill and I did not get relief, then you might assume that they didn't give it an adequate chance. If they tell you that they tried 3 different types of similar medication for a month and got no relief, then you will know that that's not a type of medication you want to start with when you're going to treat that particular patient. So for as far as the now allergy patient is concerned, you want to try and get as much information, not only about what bothers them, what is in fact their quality of life question, but what have they tried before? How did they use it? And in fact, did they read the label? Do they know exactly what it is? And you will often hear, yes, I took a little white pill, or it's the one from my favorite supermarket. And you really have difficulty, perhaps, finding out what they were taking before. Next slide. Now, most of the time, the symptoms of allergies are straightforward, and this is why the FDA have decided that allergy is a self-diagnosable condition, and medications which are safe and effective can be offered over the counter to people who can self-diagnose. And in fact, when these drugs are approved, there are special trials to demonstrate that people are making the right decisions. So what really matters when this sufferer comes to you and is now an allergy patient? So a patient or a sufferer may have a belief that they have allergies because they have classical allergy symptoms. They have stuffy nose, they have drippy nose, they may sneeze. And they know that that may be allergic rhinitis, hay fever, but it may not be. And we know there are types of rhinitis, such as non-allergic rhinitis, vasomotor rhinitis, polyps, medications which cause nasal symptoms, metabolic conditions, hypothyroidism, and many, many others that we as healthcare providers can diagnose as conditions that mimic allergic conditions. And that's something that's very important. In addition, there are those patients who have structural conditions, such as a deviated nasal septum. And so because they come into our office, we look with a speculum into the nose, we can see that their problem might not be reversible and a medication might not be the most appropriate choice of therapy for them. For those people who have classic symptoms, there may be specific activities that they can't do. For example, they may be fine indoors, but when they go out to a picnic or to a sporting event or to a school soccer game, they can't handle it because they can't handle being outside. There are those who can't handle being close to dogs or to cats. So there are many different specific patterns, and we are going to need to select a regimen of medication and perhaps avoidance to specifically target that individual. There are those people who just will not use nasal sprays, and for those people, a tablet or a syrup, very important. There are many quality of life studies that have been performed, and not all symptoms are created equally. So most people, you know, they can tolerate a drippy nose. It's a nuisance, it's inconvenient, it's embarrassing, but, you know, many people live with it. But if you have nasal congestion, if you can't breathe, that's something you just can't live with. It becomes so significant that that impacts on the quality of life to overshadow many other symptoms. And as a consequence of being blocked, someone may have a cough. The natural nasal secretions won't evaporate. They'll drip down the back of the nose into the throat, and people will complain of postnasal drip. And then if the secretions lodge in the throat, they will cough. And so we have to be alive to the possibility that somebody who has a chronic cough, when they feel it here in the throat, may have chronic allergies. There are other reasons that they may have that. They may have some reflux. They may have other conditions that cause that, but we must be aware to the symptom of allergy, that being a symptom of allergy as well. Next slide. So to get to a treatment program that really satisfies the patient and deals with whatever chronic condition we finally diagnose, the best way is to ask as many non-directed, open-ended questions as possible. Now, obviously, we're all constrained with time. Primary care, you may only have 5 or 10 minutes. A specialist allergist may spend 30 minutes or even an hour with a new allergy patient. And so there's an ability to ask far more. Some practitioners use questionnaires. Some will use some of these quality of life questionnaires to get a sense of what patients in the office, in a practitioner's office, what they are concerned about. But it's important to be very specific and ask the patient what concerns they have. If you don't speak their language or they have a culture that is different, it's important to work with an interpreter. It's important to work with someone who really is able to communicate so that you know what is really bothering them, so that you can provide relief for that specific concern. If it's I can't sleep or I am so tired, that's not just the same as treating a runny nose or sneezing. We don't want to reinvent the wheel, so it's really important to ask them what they've done before and have they done it correctly? And have they given each type of medication that they claim they've taken a proper trial? Most of the time, the answer to that is no. I took a certain medication once and I didn't like it, or it didn't help me, or I used it in the morning and you know that they should have taken it at nighttime. Or they take a twice daily medication and they've only taken it once a day, or even just as needed as opposed to on a regular basis. And so in fact, they may have, the allergy patient in your office may have already in their bathroom cabinet, in their drug cabinet at home. They may have the medication that you need to try, but you need to use it in the dosage and in the format that's indicated for the particular product. If they need to get a different product, it's not enough to say to somebody, well, get an antihistamine or get a cough medicine if somebody has a cough. I find I have to be very, very specific with patients. I write down, these are your choices, or this is what I think you should get. And it has to be very, very specific so that when they go to the drugstore and everybody's eyes glaze over at the variety of different products, branded, generic, every color in the rainbow, every type of box and size and spray and tablet. We need to be their advocate for an over-the-counter medication, because many of the over-the-counter medications were full prescription strength. We can't necessarily write a prescription for them, but we need to be a champion for particular medications and emphasize that just because something's over the counter doesn't mean it may not work if they tried it before, but they haven't used it right. So we really need to get as much information as we can from them, and then we need to give to them in a durable form, whether it's written or electronic, that we tell them exactly what we think is going to help them get relief. And then if it does, we're all happy. If it doesn't, then we need to come back. We need to have a second option, a second plan. We may need to give multiple medications. We may need to combine environmental control. We may need to do allergy testing. We may need to wash pollen out of the nose or eyes. There are many, many different treatment modalities that we might want to combine. But whether we do allergy testing or don't do allergy testing, the key to many of the treatment choices is by taking a very focused but guided history so that we know really what the patient wants. If we know what they want, then we have a much better chance of making them happy and satisfying their needs. Okay.
Wonderful. Thank you, Dr. Drews, and also Dr. Shah, for all these information. A lot that I think I have learned, a lot that hopefully the audience has learned as well. We are going to very quickly test our audience with one question to see if they remember a couple of these things. It's that one question that we want to ask you. Which domain is not measured as part of the rhinoconjunctivitis quality of life questionnaire, the RQLQ? And we don't have a polling question for you. You can answer that for yourself. And we will, of course, reveal the answer afterwards. It will be A, practical problems, or B, the emotional function, C, the activity limitation, D, the sleep problems, or E, none of the above. Which domain is not measured? And I hope you have all decided for the right answer. Only one of them is right, and this should be answer E, none of the above. All of these are measured as part of the RQLQ. Dr. Drews, Nehali, thank you so much for sharing your expertise today. It was a wonderful time that I had, and I hope the audience had as well. To everyone, thank you for your time, for joining our webinar. We appreciate your questions, and we will conclude today's event with this. Thank you for everyone for participating. Stay safe and healthy, take care of yourselves, and we look forward to seeing you next time for our webinar on allergies and pediatrics right after summer. Thank you.